We will now look at the two pathways, past and future. Beryl is 61 years old. Over the past 6 months, she has developed a pain in her foot. In the old way, the Beryl goes to the GP, who books her appointments to see a physiotherapist and a podiatrist. In the new way, Beryl contacts her GP practice and speaks to the first contact practitioner, who gives her immediate advice over the phone and arranges a face-to-face visit a couple of days later. Beryl sees the physiotherapist first and is given some exercises on the old pathway. In the new pathway, the FCP, that's the first contact practitioner, recognises that Beryl has a problem that may not be resolved by simple advice, and therefore she refers her to MSST, must. Unfortunately, the pain does not improve, and Beryl calls the GP again. The GP tells her to wait for the podiatrist appointment, as typical of the old way. In the new way, her referral is triaged within 48 hours and an appointment arranged with both the must physiotherapist and the must podiatrist at a location closer to Beryl. In the old way, Beryl goes to her podiatrist appointment, who gives her more exercises and advice and prescribes an orthotic for her shoe. In the new way, because of the prompt attention, Beryl copes with her symptoms well and is able to continue living her life. In the old system, the pain in her foot improves slightly. However, 6 months later, her symptoms change and evolve further up the leg. In the new system, she's contacted by the MUST clinical team via video link. Beryl and the team decide she needs a face-to-face appointment, which is arranged with the MUST lower limb advanced podiatrist and advanced physiotherapist. In the old way, after more visits to different health professionals and calls to her GP, she goes to visit her doctor again. The GP refers Beryl for further diagnosis in SUS orthopedic interface team. In the new pathways, Beryl goes to the appointment at the advanced practitioners and has an X-ray on the same day. A few weeks later, she travels to the local hospital for her MRI scan. The team contact Beryl via video consultation once there are results. On the old path, Beryl visits the SUS orthopedic interface team and is referred to an advanced podiatry clinician. On the new pathway, an agreement is made to see the orthotist and the foot and ankle surgeon at the local hospital. The surgeon will perform an operation at the specialist hospital. The new approach has meant that Beryl sees far less practitioners on her road to recovery. It also has taken her less than half the time to recover, and she hasn't needed to make as many journeys. Returning to the old way, Beryl goes to have an X-ray and an MRI scan. The X-rays are done 3 weeks later at a hospital, though she must wait 2 to 3 months for her MRI scan. In the meantime, Beryl visits the advanced podiatrist a couple of times and refers Beryl to the orthotics department. Beryl visits the orthotics department and discusses her MRI result with her advanced podiatrist, who can see a potential surgical target. The podiatrist refers her to the foot and ankle surgeon. After further travelling for several more visits, Beryl is seen her surgeon and podiatrist and has been listed for some surgery. Though Beryl's foot is much better, Beryl has spent over a year travelling to numerous appointments around the county. While Beryl received great care, this has been a long and frustrating road of recovery for her. However, let's turn back time and look at the new way. On the new pathway, Beryl has only 8 steps and took only 8 months for her treatment.